Hi, today we're going to be talking about the respiratory system. This is going to be the process of taking in oxygen and exchanging it for the CO2 that occurs in every cell of our body. Pretty much this is linked with cell respiration when we remember talking about that at the beginning of the school year. So we started off as the air enters in through our nose and our mouth. Okay, as it enters into the nose and the mouth, okay, it will then pass through the pharynx, and then it goes through the voice box or the larynx, and then it will pass down into the trachea and branch into the lungs, and it branches into these bronchial tubes that get into the lungs. Okay, we do have lungs on each side. There's a right and a left side with the lungs, and there is fluid that surrounds that to help reduce the friction within the thoracic cavity. If you remember from our dissections, we do have this thin wall, which is called the diaphragm. Okay, so again, the air has to travel in. It goes into the mouth, nose, goes down to the pharynx, the larynx, there's the voice box, trachea, bronchial tubes into the lungs. Lungs are very vascular. You can see that they do have a lot of different blood vessels, capillaries, arteries, and so forth. So again, it's a very vascular, and that's what's going to be getting the oxygen. Once the blood gets pumped through the heart, it has to hit to the lungs in order to pick up those oxygen. Okay. Now, as you breathe, okay, air is taking in, the diaphragm and the muscles, they actually change size of the chest cavity, okay, and that all is going to be because of what the gas pressure is inside of the lungs. So when the chest expands, the pressure within the chest and the surrounding lung fails, which will then reduce the air pressure and then force the air into the lungs from the outside. So taking a deep breath, you can feel that your chest does expand. Now, the reverse happens when you exhale. The chest will contract and it will then force the air out of the body. This is just showing you some pictures of deflated and inflated lungs, okay? And ribs are just surrounding the different lungs. Now, we do have a couple of terms that we're going to be doing in lab, but this is all on air capacity. And you're going to practice all of these terms right now. So I want everyone just to inhale and exhale. That is what's called tidal air volume. It's just a very normal, relaxed breathing. Now, if you inhale normally and exhale as much as you can, okay, that is what's called the respiratory reserve volume. So just inhale normal and then push everything out. Now, you never can totally deflate your lungs. There still is an amount that is in there. Now, inspiratory reserve volume is very hard to do because you actually are inhaling as much as you possibly can to make your lungs at maximum capacity. But there's nothing really we could do to measure that with our balloon lab that we'll be doing. Now, total vital capacity is when you add up all three. Your normal breathing, much you can breathe in, and how much you can breathe out. All of that is total vital capacity. Now, again, I said you can't always deflate your lungs. So you do have some air inside of your lungs, and that's called the residual air volume. So the total lung capacity is your total vital capacity, which is normal breathing, plus inhaling as much as you can, exhaling as much as you can, plus the residual air volume. And that roughly is about a quart of air. Okay. We also are going to count our respiratory rate, which is the number of breaths per minute. So I know you will definitely enjoy these labs. You'll be, working out a little bit. You'll be breathing into balloons and measuring how much hot air you have in, or no, sorry, just measuring the amount of air that is in your lungs. If you have any questions, please see me tomorrow. Thanks.